From the JAMA Network, this is JAMA Author Interviews. Conversations with authors exploring the latest clinical research, reviews, and opinion featured in JAMA.
Hello, and welcome to this JAMA Author Interview podcast. I'm Dr. Kirsten Bibbins-Domingo, and I'm the editor-in-chief of JAMA and the JAMA Network. My guest today is Dr. Nick Graetz, postdoctoral research associate in the Department of Sociology at Princeton University, and next year he'll be an assistant professor in sociology at the University of Minnesota. He's here to talk about a newly published article in JAMA entitled Excess Mortality Associated with the COVID-19 Pandemic for Renters Threatened with Eviction. Thank you for joining today in this podcast, Nick.
Thanks so much for having me.
You are addressing a really important problem, one that existed before the pandemic, but I think came into awareness for many during the pandemic and really related to the threat of eviction and how that relates to people's overall well-being, and in this case, very importantly, to the risk of death. Maybe you can describe what the main research question you had in mind was and how you went about answering it.
Sure. So I think this touches on a couple things related to the study of housing and health. One is that we really have not had good data to study a lot of these questions. And so this paper comes out of a big collaboration between Princeton's Eviction Lab and the U.S. Census Bureau, where we're really trying to link individuals who show up on housing court records to all sorts of administrative and census data to really understand who's affected and then what happens to them following that appearance in housing court. And the reason we have to do this is because as an administrative data source, these records in housing court really don't give you any information about the individuals affected. They're really just names and addresses. So there's not even basic information like age, race, sex, let alone follow-up indicators, as we use in this study, like all-cause mortality. So what we wanted to do here was pick out a subset of this project, which stretches back to 2000, because like you said, the housing crisis has been building now for decades. And we really picked out this period of around 2020 to 2021 to look at excess mortality among folks filed against during the pandemic, comparing to a comparison group of similar folks who experienced an eviction filing prior to the pandemic.
So you're saying one of the things that makes this challenging, the issue of housing and health, which is what you study, is that we don't have great data. And in this case, you linked a number of data sets to allow you to study and answer the question you're interested in. I do note that just as you're describing this, you're really talking about people who've already had a court action, a legal action, a filing has already been taken. So this doesn't describe the universe of people who might be threatened with eviction, who might be concerned about eviction, who might have difficulty paying rent, or any other types of things. We're really talking about things that have already entered into a court filing.
Yeah, exactly. And I should say that when I say we don't have good data to study these questions of housing and health, I'm really talking about the economic implications of the housing crisis, which, like you hit on, are rising costs for renters that sometimes result in an eviction. Of course, we have a huge literature on connections between really physical determinants of housing and health. So we can think of something like lead paint exposure, but we don't have a lot of great data to study those questions of rising costs and displacement on health. Part of what we tried to do here is link to information on rent, rising costs in the American Community Survey, the census. In a previous paper that came out a couple months ago, we looked at how those things have sort of been shaping all-cause mortality for renters. And then in this study, we picked out really the pinnacle of that, which is not going to capture the entire universe of how displacement costs affected health, especially during the pandemic, but really honing in on that group of people that we know showed up in housing court with an eviction filing during this time of really widespread infections and mortality from COVID-19.
So tell us what you found.
Yeah, so the top level finding from this study, which we looked at excess mortality, so how much higher was mortality among renters filed against during this period of the pandemic than prior, and found that it was about 106% higher. In other words, mortality rates more than doubled during the pandemic among the population threatened with an eviction filing.
So pretty substantial. Can you describe the timing relative to the filing here? How do you think about that with the data sources you have?
Yeah, so one limitation of this, of course, is that we can't really get at mechanisms. We don't have cause of death information, and we can try to look at time since the filing, but that also really slices our sample pretty small. So what we looked at here is really focused on the year or two immediately following the eviction filing. And we compared that to background mortality rates in a couple of years following eviction filing of folks who were filed against right before the pandemic to sort of look for a total average difference there.
So we've now focused in on this, as you suggest, the pinnacle of risk. These are people who've had a legal filing against them for eviction. And you're looking at the outcome that is most clear and also severe, mortality, and you're seeing this large increase. But as you said, it's hard to know exactly the mechanisms here. What do you know from the prior literature, from your understanding as an expert? What do you think the mechanisms are that really underlie this very large increase in mortality?
One thing is that there's likely several pandemic-specific mechanisms at play. I think the pandemic rental market saw really sharp increases in asking rent, which likely really increased the difficulty of finding new, stable, affordable housing for individuals who were displaced during the pandemic. And then I think there are particular consequences of eviction that likely had a big impact on risk of COVID-19 infection and potentially death, such as we can think of exposure to overcrowded housing situations, homelessness. Displaced renters likely experienced a really decreased ability to follow what was really individualized pandemic mitigation strategies like social distancing, quarantine. We can think about reduced access to pandemic-related healthcare like testing and vaccination, and potentially pressure to enter more dangerous work conditions as folks also experience job displacement either right before or after the point of an eviction filing. There's two other points that I think are important to note. One is that this is kind of the pinnacle in a lot of ways of the problem of the American housing crisis, which in many ways has to do with really rising costs for renters that have not been matched with rising wages. And so I think that is going to affect health, especially during the pandemic in a lot of ways. One is sort of through the indirect threat of eviction, sort of the specter of eviction always out there, especially in places where landlords will move very fast to evict tenants for falling behind a couple $100s on rent, where it's fast and cheap to file for eviction. And so, this situation means that renters are going to prioritize making rent at the end of each month over virtually everything else in their lives. We know that renters who are spending a lot of their money each month on rent, there's a lot of cost substitution going on. They spend less money on food security, less money on preventive health care. And so there's also going to be all sorts of compounding consequences of those things, even if folks don't actually end up receiving an eviction filing.
I know that this paper is about the pandemic. Do you think this finding is about helping us think about future pandemics? Or is it about helping us think about evictions and health more broadly?
The housing crisis is not new. The pandemic didn't induce the housing crisis. It sort of happened in the context of this bubbling crisis that's been unfolding for decades. The way to think about the results in this paper, which really focuses on a specific descriptive finding of excess mortality among folks filed against, is that we should think about these policies that in a lot of ways were really unprecedented that were rolled out during the pandemic, specifically targeted at renters. We should think of those not just as sort of pandemic era housing policy, but also as health policy that could exist anytime in the last 20 years. We rolled out these programs like the Emergency Rental Assistance Program, where the federal government allocated billions of dollars to direct assistance to renters at a time when folks were really falling behind in that first year of COVID. We saw huge impacts of those programs. It's been estimated that those reduced total filings, for example, by more than half across the country in the first couple years of the pandemic, and really helped renters get back on their feet in a lot of ways. But then now, as those programs are expiring and are sort of seen as letting pandemic-era policies expire, we're now seeing eviction filings back at historical levels in every city that we track across the country. In most cities now, in 2023, they've surpassed historical averages. And at the same time, the huge rent increases that happened during the pandemic have only started to slightly cool down. So rent is still very high over the last few years for tenants. And so this is all contributing to this context that existed before the pandemic, in a lot of ways has been exacerbated by the pandemic. And the really bold, unprecedented policy steps we took in the beginning of the pandemic are now fading away.
How I'd restate what you just said is that this is about the pandemic, but the issue that we're studying of the relationship of housing and health and housing insecurity and its effects of worsening health, those are more universal. And there are things to learn even from the positive steps that were taken during the pandemic to help mitigate risk that might be ones that should point us in the future directions for helping to understand the health consequences of the housing crisis.
Yeah, I think that's exactly right. In a lot of ways, there's a lot of inertia around some of these things. There's often this feeling of, well, it would take so much to reduce eviction filings. And we've demonstrated that it was very possible. We cut filings in more than half during the first year and a half of the pandemic. And so thinking about what kind of more fundamental lessons we can learn there, both on the positive side as well as documenting the really tragic consequences of how a lot of these things did unfold during the pandemic.
Great. I didn't know we were going to end on the positive messages, but I think that's a really important one, especially given how pressing the issues are that we're talking about here, even during a time when we're not in the midst of the first years of the pandemic. Understanding what positive lessons we can learn, I think, is a really important one. Well, thank you very much for sharing your insights into your important paper and for giving us a behind-the-scenes look at how you ask these questions and what you think the implications are.
Of course. Thanks so much for having me.
Well, I've been speaking to Dr. Nick Graetz from Princeton University and soon to be University of Minnesota. Thank you for joining me today to discuss excess mortality associated with the COVID-19 pandemic for renters threatened with eviction. This episode was produced by Shelley Steffens at the JAMA Network. To follow this and other JAMA Network podcasts, please visit us online at jamanetworkaudio.com. Thanks for listening.